Hey, how y'all doing, class? Happy Thanksgiving, happy holidays. My name is Sydney Abrams, and my topic is healthcare financing. And I found an article published by NBC, titled "Wealthy Spending More on Healthcare Than Poor and Middle Class, Reversing Trend." Before we get into this, I just think it's good to have a little background knowledge on, managed care and its variations before listening to this video or reading the article. So I'm just going to give a little background on managed care, as we're, going over this module. As the text states, managed care is a system of healthcare delivery involving complex organizational arrangements between institutions and clinics, explicit financial incentives, defined access to service, controlled use of services, and coordination and integration of services. Some of the most popular managed care variations are HMOs, PBOs, POS, and EPOs. HMOs, or health maintenance organizations, they offer the lowest deductibles. You must stay in network. You select a primary care physician, and that primary care physician refers you to specialists as needed, so on a referral basis. PPOs, they have the highest deductibles. They offer out and in network coverage, so you can do both out and inside the network of care. No referrals are needed, and no primary care physician is needed. POS, which is point of service plans, they offer less for in-network care. Referrals are needed. It's kind of a cross between an HMO and a PPO, and that you select the primary care physician, but it still allows for out-of-network coverage. EPOs, which is exclusive provider organizations, they offer low premiums, and no primary care physician is needed. And it's similar to a PPO, but you must stay in network with a EPO. Okay, so jumping into the article, um, I noticed three key takeaways from this article, and the first one is that healthcare inequality is is the new income inequality. The unfortunate reality is that although some may think it is or it starts to be, healthcare is not equal. For a lot of people, healthcare isn't equal. Accessibility and quality of care are both affected by income levels, and whether directly or indirectly. And I've witnessed this relationship between income and healthcare quality firsthand. As a child, I wasn't as fortunate as I am now, and me and my family and I, depended on public aid or Medicaid for healthcare coverage. With Medicaid, we have strict restrictions, and limited resources and access to health providers. The doctor's offices always seem to be, overly full and exceed capacity. Wait times are often lengthy. But then when my mother gained employment, her salary increased, and we switched to a private insurance and Blue Cross Blue Shield. There was a drastic quality of care difference. Through referral, we had access to specialists if need be. Being a diabetic, I needed those nutritionists um, and diabetic specialists. And Blue Cross Blue Shield offered that to us, to me. And the second key point, what I want to say about that's been a challenge for a long time now. It's always been that challenge, providing quality health care to all types of managed care variations, enrollees, and that's been a challenge. Quality's always been a challenge for managed care, and ensuring that every form of managed care meets a certain quality level that's been a challenge for our healthcare system. The second key point that I took away from this article is that the poor, despite having more health needs, are spending less on healthcare than higher income groups after decades of being the biggest spenders. People who need healthcare the most are paying for it the least and utilizing it the least. Many healthcare professionals fear that this may deepen disparities in health outcomes. The article blames the increase of the number of health insurance plans with high deductibles for lower income groups spending less on healthcare, coupled with stagnant wage increases, wage growth. High deductibles, which is the amount patients pay out of pocket for healthcare, out of pocket costs before seeing a doctor, can discourage healthcare usage for individuals, especially individuals with lower incomes. And the third key takeaway that I took from this article is that middle and upper class groups say that deductibles and cost sharing features such as co-paying and co-insurance are, bending the cost curve of health spending. But it has come at the expense of poor and some middle class groups. However, the Obamacare or the Affordable Care Act has benefited these lower income groups, by expanding Medicaid programs to cover more people, which usually has no or very low cost sharing features, cost sharing requirements. And with Obamacare, there's no premium attached to that either. So premium is just a monthly expense for you, employee, or the employer towards healthcare. Even though the author views the Affordable Care Act as a partial solution at best, because many Obamacare plans offer high deductibles still, of up to $6,000. So the author really was trying to say that and explain that the Obamacare system is lacking. It's a good system, but it's not a fix all. It's a temporary solution at best, and we still need to strive to make sure the quality in healthcare is offered to all. And that's really what I took away from this article. I'll post the discussion questions in the discussion post along with this video. And I just want to thank you all for taking the time out for listening to me and engaging with my discussion post. Thank you.